Breaking news. There have been several recent reports about the outbreaks happening at the well-known Disney World amusement parks. These are all cases of the Rubeola virus, or more commonly known as the measles. This is not to be confused with the Rubella virus, which is more commonly known as the German measles. Rubeola and Rubella both use only humans for reservoirs. From the time of infection, the incubation period for Rubeola is 10 to 12 days. For Rubella, it's going to be 14 to 21 days. They are both transmitted from person to person through droplets. For Rubeola, it is more highly contagious. It can be aerolized. It is rare, but it can happen. It can also be transferred through respiratory secretions. For Rubella, it is quite different. It can be transferred from mother to unborn child through the placenta. Now to Dr. Snout to give more information on both of these viruses. Well, thank you. Let's jump right on the morphology of these viruses. Rubeola belongs to the family Paramyxovirus and genus Morbillivirus. Rubella belongs to the family Togavirus and the genus Rubevirus. These both are enveloped pleomorphic spheres and encode 3 proteins, which are P, C, and V proteins. Rubeola has 2 very important proteins contributing to the pathogenicity of the cell. F fusion protein fuses virus and host cell membranes and allows the viral penetration and hemolysis to occur. H hemagglutinin protein allows absorption of virus to the cells. Rubeola has negative stranded RNA. Rubella has non-segmented positive single-stranded RNA. Rubeola has the helical nucleocapsids that are coiled helix of protein RNA and includes tinnin and fusion glycoprotein spikes. For the Rubella virus, there is a icosahedral capsid surrounded by a lipoprotein envelope and several surface proteins. Thank you. Back to you. Thank you, Dr. Snout, for such a riveting lesson. This just in, we have someone interviewing one of the people affected at the tourist attraction. Here's live with Susan Jane to share her experience with her symptoms through all of this. I just wanted to share my story. I never got vaccinated as a kid, and I never thought I was going to need it. I never saw it in my day-to-day life, but with this outbreak, I definitely got infected. I have this rash that is all raised and everything. I've had a fever of 103 to 105. I've had a cough and a runny nose, conjunctivitis, like pink eye, and white spots in my mouth. They call it Copic spots. And my doctor says I could have complications like a spontaneous miscarriage, low birth weight if I have a kid, like the baby will be really underweight. I could have laryngitis, ear infection, a whole bunch of other infections. My neighbor actually got the Rubella infection, the German measles. They had the same fever, cough, runny nose, and a rash, but their skin peeled and they had joint pain. They also could have miscarriages and birth defects in their kids, as well as mental retardation, eye defects, and possible CNS. It's pretty scary stuff. Thank you for sharing your experience with us, Susan. Hope everything clears up. Now, back to Dr. Snout to teach us how these diseases go through the body. Now, let's talk about the pathogenicity, or the way it travels across the body. For the Rubeola virus, it is a systemic infection. which means it occurs all over the body. It originates in the respiratory tract and enters the lymphatic glands. From here, it will enter the bloodstream and spread to other lymphatic organs. After about 6 days, generalized viremia occurs and spreads to the skin and lungs, which can lead to secondary infection of the ears and eventually the brain. For 7 days, a host is contagious and shows signs and symptoms. For the rubella postnatal infection, it will only last 3 to 4 days and is taken up by the lymph nodes and then the bloodstream. Replication would occur in the upper respiratory tract, and from here, the virus disseminates to all parts of the body. Circulating virus will react with antibodies, causing antibody-antigen complexes to occur. This can lodge into the skin, causing rashes and joint pain. For the congenital infection, it will be practically the same as the postnatal, from the replication occurring in the respiratory tract to the virus disseminating to all parts of the body. But from here, it will cross from the placenta to the fetus. If fetus survives, it would excrete the virus months after the birth. It is a very high mortality rate, and it will affect the overall growth of the developing fetus. For those who have been affected or have not been vaccinated, there is no real treatment options. The only treatment options are to treat the symptoms like fever reduction, pain management, and fluid replenishment. Vitamin A is given as a supplement to try to help the symptoms. Anti-itch lotions for the rashes, and antibiotics will be given for additional infections caused from bacteria. The best thing to do to minimize the spread of this virus and this disease is to get vaccinated from the MMR. The MMR comes in 2 doses. It's typically taken at 12 months old and at 4 to 6 years old. The other option is to isolate from any type of infection, but the best option is to get vaccinated. Some other facts that come with these viruses are 30% of children affected with the congenital rubella have died. 1 person with measles infect about 12 to 18 people. And 2 recommended doses are less than $2 per child. So please get vaccinated and get rid of this outbreak. Thank you, and back to your regularly scheduled program.